Hello and welcome to this Introduction to Infection video. I'm Dr. Aled Roberts, and in this video we're going to look at pertussis, more commonly known as whooping cough, as an example of an upper respiratory tract infection. Now, this particular disease is caused by the gram-negative bacterium Bordetella pertussis, which enters our upper respiratory tract via respiratory droplets expelled when an infected individual coughs or sneezes. These droplets are then inhaled by a new host and deposited on the ciliated epithelium of the trachea and bronchi, where the bacteria adhere and begin to colonize. Now, the infective dose is relatively low, and the incubation period is typically between 7 and 10 days for this infection. And for the most part, the bacteria remain confined to the respiratory epithelium, where prolonged colonization and toxin production disrupts normal airway function. Now, the pathology of pertussis arises from damaged ciliated epithelial cells, resulting in impaired mucociliary clearance and immune dysregulation, and it's the failure of mucociliary clearance combined with airflow-driven redistribution that can sometimes allow migration of this infection from the upper to the lower respiratory tract. But how does Bordetella pertussis achieve infection? Well, it relies on the production of a number of toxins, such as the pertussis toxin and the tracheal cytotoxin. Now, the pertussis toxin is an AB toxin that does not directly damage epithelial cells, but targets immune cells and disrupts intracellular signaling by increasing cyclic AMP levels. The knock-on effect of this action is reduced phagocytosis and delayed immune clearance, creating a localized environment within the airway in which Bordetella pertussis can persist for prolonged periods of time. Then, as infection progresses, the tracheal cytotoxin paralyzes the cilia of epithelial cells, causing mucociliary clearance to stop and mucus to start building up in the airway. This leads to coughing fits, which define the disease as the body tries to mechanically clear the infection. Now, at this point, the bacteria is reliant on adhesins, namely filamentous hemagglutinin, pertactin, and various fimbriae. Together, they ensure stable attachment to cells of the respiratory epithelium, stopping mechanical removal by coughing. Now, in addition to this, the close proximity of bacterium and host cell allows the other toxins to be delivered more effectively. And so adhesins do not cause tissue damage directly, but they are essential for sustaining the toxin-mediated pathology of pertussis. Now, pertussis follows a 3-stage clinical course, and understanding these stages helps explain both its symptoms and why it spreads so effectively. The first stage is the catarrhal stage, which lasts around 1 to 2 weeks. During this phase, Bordetella pertussis begins damaging the respiratory epithelium, leading to mucus accumulation in the airway. Symptoms resemble a common cold, including fever, runny nose, and a mild cough. Despite the mild presentation though, this is the most highly contagious stage of infection. This is then followed by the paroxysmal stage, typically lasting 2 to 6 weeks. By this point, the cilia are paralyzed, so mucociliary clearance is lost and epithelial cell lysis leads to a buildup of mucus and cellular debris. This results in the classic pertussis symptoms: paroxysmal coughing fits, which occur up to 50 times per day and consist of rapid coughs during a single exhalation, followed by a forceful inhalation that produces the characteristic whooping sound. And finally, we have the convalescent stage, which can last weeks to months. The pathogen has been eliminated, but coughing gradually resolves as the respiratory epithelium recovers, often persisting well after bacterial clearance. Now, as soon as pertussis is suspected, preferably during the catarrhal stage, the patient will be given antibiotics effective against gram-negative bacteria in order to reduce the duration and severity of the disease. Macrolides tend to be the preferred antibiotics, with azithromycin preferred for its short course and lower dosing. Clarithromycin is very good in neonates due to fewer side effects, while erythromycin is not readily used as it is a longer course with more side effects, but it is still effective. Now, in addition to this, we are proactive against pertussis. We have a highly successful vaccination program using the Pertussis toxoid, which has made pertussis cases extremely rare. Now, the vaccine is made from an inactive form of the Pertussis toxin, capable of stimulating an immune response without any of the disruption to the host cell signaling. In addition to this, it contains various adhesins such as filamentous hemagglutinin and pertactin, which induce antibodies that can help block the adhesion of Bordetella pertussis to ciliated epithelial cells. Now, vaccination against pertussis is delivered multiple times as part of the DTaP vaccine known as Tripedia, combining vaccinations against diphtheria, tetanus, and pertussis. Now, vaccination is thought to prevent around 85% of cases in children. However, there are concerns as those vaccinated are still thought to be carriers of disease, potentially allowing for transmission. And with that, we come to the end of this video. I hope you found the content useful, informative, and most importantly, easy to understand. Thanks for watching, and I hope you have a great day.